Yes,
We
please
are live?
start.
Yeah. गुड आफ्टरनून, नमस्कार। मेरा नाम डॉक्टर भुवनेश्वर पांडे है। मैं आप सभी लोगों का स्वागत करना चाहता हूँ, अभिनंदन करना चाहता हूँ इस जून माह के रस संवाद में। जैसा कि आप सभी लोगों को अवगत है कि हम हर महीने एक रस संवाद, एक वेबिनार का, डिजिटल वेबिनार का आयोजन करते हैं, जिसमें कि हम पूरे भारतवर्ष से किसी एक रस वैद्य को या रस वैद्यों के समूह को आमंत्रित करते हैं तथा हम रस औषधियों के ऊपर डिस्कस करते हैं, विभिन्न बीमारियों के ऊपर डिस्कस करते हैं, कैसे हम आयुर्वेद को आगे बढ़ा सकते हैं थ्रू आउट द रस औषधियाँ या कोई अदर अपने एक्सपीरियंस या अनुभव के थ्रू आउट, कि कैसे हम जीर्णाजीर्ण व्याधियों की चिकित्सा कर सकते हैं। तो ये सब हमारा एक उद्देश्य है कि हम कैसे हम आयुर्वेद को आगे बढ़ाएं। तो उसी उद्देश्य के तहत हम हर माह एक रस संवाद का आयोजन करते हैं। उसी रस संवाद की श्रृंखला में आज का जो हमारा रस संवाद है, वो उसके लिए मैं स्वागत करना चाहूँगा हमारे दो स्पीकर्स का, जिसमें कि मैं उनके बारे में थोड़ा बताना चाहूँगा कि दोनों स्पीकर हमारे हिंदुस्तान के रिनाउंड इंस्टीट्यूट से हैं। मैं स्वागत करना चाहूँगा हमारे प्रोफेसर महेश व्यास सर का। ही इज डीन, प्रोफेसर एंड हेड ऑफ द डिपार्टमेंट ऑफ संहिता एंड सिद्धांत इन ऑल इंडिया इंस्टीट्यूट ऑफ आयुर्वेदा, न्यू दिल्ली। सो वेलकम यू सर। डॉक्टर जितेंद्र का मैं स्वागत करना चाहूँगा। डॉक्टर जितेंद्र, ही इज एमडी पीएचडी इन काय चिकित्सा एंड ही इज वर्किंग एज ए असिस्टेंट प्रोफेसर इन पीजी डिपार्टमेंट ऑफ काय चिकित्सा एट चौधरी ब्रह्म प्रकाश आयुर्वेद चिकित्सालय संस्थान, न्यू दिल्ली। ये दोनों इंस्टीट्यूट हमारे भारतवर्ष के रिनाउंड इंस्टीट्यूट हैं आयुर्वेदा के, जहाँ पे मैं अगर बात करूँ चिकित्सा की, तो यहाँ इन दोनों इंस्टीट्यूट्स पे चिकित्सा भी हमें एक उत्कृष्ट चिकित्सा का हमें देखने को मिलती है। बिकॉज यहाँ ये इंस्टीट्यूट हैं जहाँ पे आपके बहुत सी चीज़ों का, पेशेंट्स का भी आउटफॉल अच्छा है, टीचर्स भी अच्छे हैं हमारे, और जिसे कहें संसाधनों से भी संयुक्त हमारे दोनों इंस्टीट्यूट हैं। तो इन्हीं दोनों इंस्टीट्यूटों के हमारे जो आज के स्पीकर्स हैं, मैं उनका स्वागत करना चाहूँगा। आज का जो हमारे रस संवाद का जो टॉपिक है, वो एक टॉपिक जिससे भारतवर्ष में कुछ टाइम के बाद इंडिया इज टू बी कैपिटल ऑफ डायबिटीज़। तो वेबिनार का जो हमारा आज का उद्देश्य है कि कैसे हम डायबिटीज़ मेलाइटस का ट्रीटमेंट कर सकते हैं, उपचार कर सकते हैं, कैसे उससे बचाव कर सकते हैं थ्रू आउट द आयुर्वेदा, क्या क्या उस चिकित्सा पद्धति हम क्या क्या दवाइयाँ यूज कर सकते हैं, क्या क्या हम अपने लाइफस्टाइल में चेंजेस कर सकते हैं। तो उस सब के बारे में हम आज जानकारी लेंगे। मैं दोनों अपने स्पीकर्स का स्वागत करना चाहता हूँ डाबर परिवार की तरफ से। साथ ही इंडियन वैद्यास का भी स्वागत करना चाहूँगा, जिनके प्लेटफॉर्म पर हम ये अभी वेबिनार कर रहे हैं। ओवर टू यू सर। अगर किसी भी दर्शक की, किसी भी श्रोता की या किसी भी डॉक्टर की कोई क्वेरी होती है, प्लीज़ चैट बॉक्स पर अपनी क्वेरी को मेंशन करें। हम एंड ऑफ द सेशन में आपकी क्वेरी को दूर करने की कोशिश करेंगे। ओवर टू यू सर। प्रोफेसर महेश सर फर्स्ट।
Namaskar. Today's guest speaker, Dr. Jitendra Varsakiya ji, Dr. Durga Prasad ji, General GM Marketing, Dr. Bhuvaneshwar Pandey ji, Product Manager, Dabur India Limited, and all the participants. Good afternoon to all. At the outset, I first of all want to express my sincere gratitude to the organizers for providing me this opportunity. I am so happy and feeling very honored to be invited as the guest of honor in today's webinar organized by Indian Vidyas and Dabur India Limited. I also extend my heartfelt appreciation to the organizers, Dr. Durga Prasad ji and Dr. Bhuvaneshwar Pandey, Product Manager, Dabur India Limited, for promoting such platforms that encourage knowledge sharing and academic excellence. It is through such forums that ideas are exchanged, new perspectives emerge, and collaborations are encouraged, ultimately leading to the advancement of knowledge and the betterment of healthcare facility. Already, Dabur India Limited is a very well established name, and it has always come out as a best example of innovation and quality in the field of healthcare and wellness. Their dedication to promoting traditional wisdom along with modern scientific advancement is commendable and truly reflects their commitment in improving lives through natural solutions. What I admire most about Dabur is their commitment to quality, purity, and safety in all their products. For over a century, Dabur has been at the forefront of bringing the ancient wisdom of Ayurveda to the masses and making natural health care accessible to all. I honestly appreciate and congratulate Dabur India Limited for its big achievement. I also admire the topic of discussion of today's webinar, which is on management of diabetes mellitus. We all very well know that diabetes is one of the fastest growing health challenges. According to the International Diabetes Federation, there are over 537 million adults living with diabetes worldwide. And this number is projected to rise to 783 million by 2045. In India alone, there are over 77 million people with diabetes, making it the country with the second highest number of diabetic individuals globally. Diabetes has become one of the major cause of blindness, kidney failure, heart attacks, stroke, and lower limb amputation. In 2021, diabetes was responsible for 6.7 million deaths worldwide. However, the good news is that with proper management, most complications of diabetes can be prevented or delayed. And if I talk exclusively about Ayurveda alone has so much potential to deal with this health crisis so effectively. This is why forms like this webinar are so important in raising awareness about diabetes and educating people on effective management strategies. By bringing together experts, healthcare professionals, patients, and the general public, we can work together to combat this growing epidemic. So, yes, definitely bringing distinguished experts, Dr. Jitendra Varsakiya, as today's eminent guest speaker is a very nice move in this regard. And I am so confident that his vast experience, expertise will enlighten the listeners. Their insightful discussion on today's topic will provide with new perspective and vision. I strongly believe that their deep expertise and wealth of knowledge on this critical health topic will give new insights. Their deliberation are indeed invaluable in better understanding the complexities of this condition and the latest advancement in its treatment and care. So, to all the listeners who have been the part of today's event, you all are very much fortunate that you got the opportunity to listen to such eminent speaker. In closing, I congratulate the organizers once again for their outstanding work in organizing this seminar and for their intense commitment to promoting excellence in healthcare. I encourage all participants to make the most of this opportunity to learn, engage, and contribute to the meaningful discussion that lie ahead. Thank you once again for having me there, and I look forward to a day filled with insightful discussion and fruitful interactions. Best wishes for a successful and enriching seminar. Thank you once again. Thank you very much.
Thank you so much, sir.
Thank you, respected sir, for your very valuable words. It is really inspiring for me and all the Ayurveda fraternities. Good afternoon, everyone. It is both an honor and pleasure to present before you today at this distinguished webinar dedicated to Ayurveda and ancient system of healing that had stood the test of time and continue to offer a profound wisdom for modern health and well-being. In the gracious presence of respected Professor Mahesh Vyas sir, Dean, PhD, All India Institute of Ayurveda, and our mentor, well-known personalities in the field of ancient science, sir have the knowledge is always inspired to each and every fraternity of Ayurveda, and especially for me. Today, as we here to explore the rich tapestry of the Ayurveda knowledge in the field of diabetes mellitus, whether you are a practitioner, a student, or a someone with a keen interest and holistic health, I hope that the discussion and insight shared have will inspire you and deepen your understanding of the profound science of the Ayurveda in the field of diabetes. Thank you, Dabur India Limited, for inviting me to speak a little talk regarding these issues. I look forward to you the enlightening the session ahead. Without wasting much time, I am coming to direct my topic: management of diabetes mellitus. Please next slide. Globally, an estimated 422 million adults were living with the diabetes in 2014 compared to the 108 million in 1980. Means 40-year gap is too high, but number is also too high. This is because of globalization and urbanization. A study show by 3 years after diagnosis of the diabetes, approximately 50% of the patient will need more than one pharmacological agent, like multiple therapies, including pharmacological agents as well as insulin, and 75% will require multiple therapies to achieve HbA1c level below 7 along with the insulin. Some of the patients do not attain the controlled blood glucose even after taking multiple therapies or agents for the diabetes. Diabetes is one of the most common non-communicable diseases globally. It is the fourth or fifth leading cause of death in most high economic countries, and there is a substantial evidence that it is epidemic in many economical developing and newly industrial countries. It has been narrated in Ayurveda that the long period of the physical inactivity, laziness, sleeping, or long hour, excessive use of the food, which is heavy to digest, likely dairy products, aquatic and musky animals, sugar or jaggery preparations, fresh grains, etc., and similar foods that increase the kapha dominancy are generalized cause of prameha, which covers up in Ayurveda terminology, prameha, diabetic mellitus. Diabetic mellitus is taken from the Greek word diabetes, meaning sihon, to pass through the Latin word mellitus means sweet. A review of the history shows that the term diabetes was first used by the Japanese of the Memphis around 250 to 30 BC. Similarly, in Ayurveda, the cardinal features which mentioned in our classics is also quoted that Prabhu Tawil Mutrata, a copious flow of turbid urine. It means in our essence science also these type of symptoms and diseases are narrated before so many years until the knowledge of these things in is already available in our classics. In Ayurveda, classics have been described several formulations for treating the diabetes. The role of the Ayurveda, please next slide please. The role of the Ayurveda anti-diabetic formulations need to be studied for controlling hyperglycemia. This is the need of our to search the sources as an anti-diabetic herbal formulations mainly utilized to treat the hyperglycemia. We have to search need कीजिएगा. Some of the premonitoring signs and symptoms which are mentioned in our classics. Next, please, sir. Next. Some of that are sweet taste in a mouth. Next. Next slide. Sweet taste in a mouth. Attraction of the insects, ants to the urine or person because of sweetness of the urine. Dryness in the mouth, palate and throat. Thirst, excessive thirst or drowsiness, excessive sweating and foul smelling from the body, lethargy, unhygienic body, excessive deposition of the waste product in a palate, tongue or teeth, matting of the hair, abnormal appearance of the urine, and numbness and burning sensation in hand and feet. These all features are mentioned in our ancient classics in the Sanskrit terminology, but here I am putting in a translated terminology. This is acceptable by government. So this is the predominant features mentioned in our classics. Some of the cardinal features by that we can assure that this is the diabetes. Polyuria, increased urination. Polyphagia, excessive appetite. Polydipsia, excessive thirst. Unusual weight loss or weight gain. Fatigue. Nausea, perhaps vomiting, blurred vision. In a human, frequent vaginal infection. In a man and woman, yeast infection, dry mouth, slow healing or sores or cuts in the skin mucosa. Itching of the skin, especially in the region of the groin or genitalia. This is the some of the cardinal or clinical features of the classics with mention in modern science as well as Ayurveda science similarly equally. Next, please. What is the investigations need to diagnose the perfect disease? We need so sugar, random blood sugar, glucose tolerance test (GTT), glycosylated hemoglobin (HbA1c) test, urine test, glucose, albumin, and ketone, etc. test also included. C peptide. C peptide is a simple, cost-effective, and non-invasive method in the assessment of the beta cell therapy. This is the most important test. Insulin test, blood urea, ECG, lipid profile, and serum electrolytes. By this investigation, we can ensure the root cause of diabetes as well as the perfect diagnosis of the diabetes. Diagnosis is definitely definite defined by the WHO recommendation. Fasting plasma glucose greater than 7 millimole or 126 millimole per dl. Plasma glucose 11 greater than 11 millimole or above the 200 mg per dl is perfect diagnosis for this one. Next one, please. Management approach. This some idea I given the introductory of the diabetes and etc etc. Now coming to Ayurveda portion. Management approach. In our Ayurveda, we have firstly focus on the swasthasya swasthya rakshanam and aturasya vikara prasavanam. Swasthasya means जो person have the healthy state, we have maintained that. So before the diabetes or in the context of the prevention of diabetes, we can advise for the nidana prevention, avoidance of the etiological factors, Southern therapy, biocleansing of the body, cleansing of the body by using a biopurification measures also mentioned in our classics. Likewise, the selection of the biocleansing strategy or measure depends upon the dosa prominency, like kapha prominency in patients like advised by MSCs or Virachan, etc. etc. It depends on the dominancy of dosa. Both. Next one is the palliative treatment. The drugs formulation which are useful in our classics in already in the mentioned in the detailed treatment for the diabetes mellitus or a prameha, which can one most important is diet and lifestyle modification. So we are firstly starting from the nidana parivarjan, aversion of the etiological pattern. In our classics, there is a quotation given, ये हेतु या हेतोर सेवा विहिता तथैव जातस्य रोगस्य भवेत् चिकित्सा. Means जो भी बॉडी को एवर्स कर रहे हैं, जो etiological फैक्टर है जो उसको प्रमोट कर रहे हैं, उसको अवॉइड करना. Diet. Which diet is helpful to prevent or manage or to peril the diabetic mellitus? Excessive intake of the dadhini. This diet can be the etiological factor on species animal. Milk preparations, freshly harvested foods, articles and freshly prepared alcoholic drinks, preparation of the jaggeries, excessive use of the oily and spicy foods, pizza, burger, and etc. etc. Excessive slurry diet means cheese, paneer, this. In this condition, in this type of diet, it increases the kapha dosa, which vitiated the made, clay, and lasika of the body. This is the elements which play a major role to the pathogenesis of the diabetes mellitus and cause the disease. Next one, dietetics habit means overeating. Overeating, then no any exercise, only sitting, etc. etc. Then on like sedentary lifestyle, we can say psychological factors, less worry, less mental work, affect sugar many ways, like it increases insulin secretions the body. This can happen by the psychological fact. Lifestyle, addiction to the pleasure of the sedentary habits and excessive sleep, less enthusiasm, no physical work. Acharya Sushrut, in our classics, the Acharya has mentioned lifestyle for the prevention of the lifestyle is the Saitya Atma Yojana Satan Adhiktam Yagachet. एक्टिविटी और फिजिकल एक्टिविटी एनहांस करने की बात बोली गई है. डाइट. नेक्स्ट, सर्वमन्य परित्यज्येत सर्वमन्योपालीयेत. देयर इज अ कोटेशन इन आवर क्लासेस. Everything, leave the everything, but focus on our body. First you focus on your body, then do the everything. Sarvamanya parijajyet sarimannupaliyata. What thing? Take the 1 glass of the yava mantha, 2 to 3 spoon yava roasted and then powdered, plus 1 glass of the water warm, churn and filter. This is the helpful to in diabetes mellitus. Morning breakfast. Take light to light food like 2 khakras made by the barley flour or one ball or boiled green gram or Bengal gram. This is the best morning diet or morning breakfast for the diabetic person. Next one, please. Coming to midday meal. Before commencing the meal, 1 cup of the warm, clear vegetable soup or any green leaf soup we can take. Salad, cabbage with the rock salt and black pepper powder. Take salad, but boil it. Don't take it boil it. 2 to 3 chapatis made from the barley flour or mixed flour of the wheat and barley. Vegetable like bitter gourd, ridge gourd, parabol, fenugreek leaves can give. Half bowl of the sama, panicum fenugreek. The sawa have the best property to reduce the glucose level. That's why we can administer it because sawa have the rukskuna. 1 bowl of the dal, mung dal or adki, tuhar dal, ya arhar dal. We can take that time. Now coming to after food, afternoon or evening time food. Give the one glass of the yawmat again in afternoon or chana evening snacks. In coming to dinner portion, we can give kodro with the mung dal sira we can give. You 2 to 3 small chapatis made from the barley flour we can give. This is the morning to evening diet for the diabetic person. It also can helpful to prevent or control the diabetic index in the particular patients. There is so many medical or treatments classes treatment or like single drug. So we can use the avla, Phyllanthus umbilica fruits. We can use haridra, curcuma longa, rhizome 1 to 3 gram. Next slide, please. Use the jambu, Syzygium cumini, jambu seed. We can leaf. We can give the methika leaves or shade. Try swaras of leaf or pulp. We can use the neem, Azadirachta indica, seeds, leaf, and stem bark for the this type of ailment management. We can use the Vijay Sahara stem, Pterocarpus marsupium. We can use the Carvel luck, bitter gourd in the form of the sabji, vegetables in the form of the powder, seed in form of the everything. We can use the medicament. Next, please. There is the classics. Some of there are the Trifla Churna. This is the best remedy for the diabetic person because of there is a dhatukshay also. There is the metabolism disturbance also. The Trifla have the Sarvadhatu Posagun and it very useful to improvise the metabolism of the body. So Trifla Churna we can use. Amla ki swaras, I also mentioned in previous slide the Amla powder. Faltrikadikwa, there is a kara mentioned in our classes, the combination of the 7 herbs, which useful in this type of areas. Kokshura di Google is the also used the Yoshadi Google, Chandra Prabhavati, Devdarya di Kwatha, Dhananda Grita, Shirbara Tel, and Saptamrit Law. Now coming to the mode of action of this type of medicine, how it act in the diabetic element. So first of all, I'm next this. There is a in here is that Rason Methika, Agnidipan Pachan Renu Sotos. According to the Ayurveda perspectives, Prameha is the multifactorial disease involving the Jatra digestion and Dhatu digestion and metabolism at the tissue level. The context of the this or medicines helps to improve the action of primarily seen in patients of diabetes like phenom, gratium, lean, and cetavine can increase the digestion and help to reduce the blood sugar. As the pancreas is the one of the site for the agni, it can be interpreted that the herbs mentioned above can stimulate the pancreas to secrete insulin. The action of the herbs in reducing cell resistance to insulin also be studied. That's why these all medicaments are very useful to treat the this type of ailments. Which are have the Tiktarasa, Kasai Rasa, Ruksha Guna, and Kled Sosan property. So that's why it also used in the Madhumeha patients. Next slide, please. Next slide, please. The pharmacological action of these medicaments can be interpreted based on the Ayurveda literature and relevant research. In Ayurveda, the antibiotic and slash mahar property of the Vijayasara are mentioned. It contains the epicatechin, benzopyrazine as an active principle. Epicatechin increases isolate cyclic adenosine monophosphate content, which is associated with the increased insulin release. Also, is useful to treat this. Additionally, it has the insulin human erythrocytes. It corrects neuropathy, retinopathy, and disturbed metabolism of the glucose and lipids. It maintains the integrity of all organ system affected by the disease. Kafar and Medhar, Dipan, Carminative, and purgatives property of the mesringi are mentioned in our early classics. Moreover, experimental studies have previously proven its antidiabetic, hypoallergenic, and beta cell regenerative activities. Methika phenomenon possesses the Vata slash Mahara, pacifies the Vata and Kapha dosa property, and due to its pungent and hot nature can help to enhance the food and fat digestion. For the 4-dehydroxyisoleucine amino acid from fenugreek seed increase the glucose induced insulin release through a direct effect on the through a direct effect on the release of the Langerhans cell. Actually, Kashyap has mentioned the rasona as a rasayan, one of the most useful kitchen remedies for the this type of ailment. Rason, lasun, garlic. Garlic have also antibiotic property, have also been established as an experimental study also. Moreover, Acharya given the reference on classic rason as a drug of choice for all the manifestation of the metabolic disturbance. What except the combination of the Rakta and Vita. Due to this action, changes on the fasting and postprandial blood sugar. There is a one more drug given in class as a Bilwa, eagle marvelous. The potential hypoglycemic activity of an adequate extent of the eagle marvelous diabetes and albino rats were treated with the ethanol extract leaves the blood glucose lowering effect, and studies have glucose oxidase as a method. Aquatic acid of the bilva seed was also proven the anti-diabetic and anti-hypo lipidemic effect on the diabetic rats. This can be helped to use in human for the diabetic persons. Now coming to lifestyle modification, we can advise the patient to give the time for the body like 30 minutes of brisk walking in a fresh air in the morning. Patient ask patient to do the Surya Namaskara, which is very useful. There is a 12 asana in a Surya Namaskara, which all are asana improvise the metabolism of the body. Regular exercise, yoga, avoid day sleep, 30 minutes brisk walk, take proper sleep at night and early morning awakening, and avoid the stress. This is the key factors to control the diabetes. Physical activity has been shown to reduce the hyperinsulinemia and improves the insulin peripheral activity. Stress blocks the body from release insulin in people with type 2 diabetes. So, cutting stress may be more helpful for these peoples. Next, please. Some of the yoga we can advise patient like in diabetic species asana is indicated which stimulate the endocrinal gland, vitalize and improvise its function and secrete the pancreatic secretion properly have to maintain its proper function. Gomukhasan stimulate kindly function, kidney function, activate the bladder and the digestion system, and also counter the diabetes. There is one more Salpasan is also very helpful to activate the pancreatic secretion. There is a Halasan beneficial for the pancreas. Is therefore recommended for the people with diabetes. There is next one, please slide. Mayurasan. Mayurasan is good exercise for the liver as well as pancreas. Ardhamasyadasan is also stimulate the pancreas and activate the insulin secretion cells. Bhujangasana it also very effective to activate or generalize the pancreatic metabolism and flow to the pancreas metabolism. Coming to the conclusion, it is hypothesized that most of the drugs work by improving the insulin production and or increasing the insulin sensitivity. These all drugs which mentioned in our classics may be used as an adjuvant to conventional insulin therapy in case of the type 1 diabetes, also with an objective to improve the glycemic control and overall quality of the life and to prevent the long term. So my take home message is that uh, for the prevention of diabetes, maintain your diet and lifestyle. For the prevention and control of the glucose level, please implement the exercise yoga in your routine life and care for the diabetes, also your diet and also your routine lifestyle. Avoid stress, stay cool, stay happy. Thank you so much, Dabur India Limited, for giving me this opportunity to share my views on the diabetes mellitus and to helpful to people and scholars to aware about diabetes mellitus and etc. Thank you so much.
Thank you so much, Dr. Jitendra, for
Thank you.
your valuable words and it's a nice presentation. आई होप कि हमारे सारे व्यूअर्स को काफ़ी चीज़ें समझ में आई होंगी और उन्हें काफ़ी हेल्प आउट हुआ होगा कि अपने क्लिनिकल प्रैक्टिसेस में वो कैसे डील कर सकते हैं डायबिटिक मेलाइटिस से, कैसे उसका ट्रीटमेंट प्लान कर सकते हैं, कैसे उस चीज़ को उसके कॉम्प्लिकेशंस को टैकल आउट कर सकते हैं. सो आई होप कि बहुत से लोगों को आपकी इस प्रेजेंटेशन से फ़ायदा मिला होगा. मैं आपको डाबर परिवार की तरफ से आपका बहुत बहुत धन्यवाद करना चाहूँगा
Thank you,
कि
sir.
आपने अपना वैल्यूबल टाइम दिया और हमारे प्लेटफॉर्म में आके आपने इस टॉपिक को पे अपने पॉइंट ऑफ व्यू रखे. सो हियर इज सम क्वेश्चंस. अगर फास्टिंग ग्लूकोज 117 एंड पोस्ट 92, व्हाई फास्टिंग इज मोर देन पोस्ट? Question of Devendra Kumar Tiwari. He wants to know that fasting 117 and post 92, why fasting is more than post? I think I think देवेंद्र जी को थोड़ा देवेंद्र जी.
Yes, got it. Here
Okay,
he is asking about the fasting in 117 and post is 92. It
postpartum is
depend on the metabolism. Maybe
yeah.
patient not have taken the properly medicaments. Patient has not the physical activities, and there is a no in control of the diet, which after metabolism it increase. That's why it may be possible that fasting is more than the POs.
So here is one more question. How can we use Silajituya or Silajit in
Yes,
cases
we
of
can
diabetes?
use Silajit. We can use Silajit as a rejuvenation for diabetic person, because I have seen that in the diabetic person there is a neuropathy. Diabetic neuropathy problem is developed after the long time effect because of the medicament and the diabetes problem. So there is in this the condition of the diabetic neuropathy, the Sirajit is very helpful because the Sirajit have a rejuvenation effect. It also work in the musculoskeletal disorders. Also, we can use in the sexual disorders, because diabetic person have also later on stage feels their erectile dysfunction and also. So in this condition, Silajit can be used as a prevention of the diabetic complication.
And how is Basant Kusmakar is beneficial for the diabetic patients?
Yes, please, sir.
Basant Kusmakar Ras,
Yes, Vasan
how the
Kumar,
Basant Kusmakar
when there is a diabetic, uncontrolled diabetic person, at that time we can use the Vasant Kusumar Ras as a regimen, because Vasant, no need of the pre-diabetic person or a starting level of the diabetes. So in the diabetic person, we can use the Vasant Kusumar Ras with the Vijay required, because the vehicle is most important. Vijay Saradi, Asan, and Khadir is the main medicament given our classical text Charaka for the single drug. So Vijay Asanadi or Vijay Saradi Quat can be given with the Vasant Kusumakaras 1 tablet morning evening. It is very helpful to reduce or avoid the chance of neuropathy in the patients.
and how can Ayurveda cure diabetes completely? Dr. Preeti wants to know. Can
What's
Ayurveda
your
cure
question, please?
diabetes?
How can Ayurveda?
Dr. Preeti has
Yes.
question. Can Ayurveda
If
cure
if
diabetes
if
completely?
yes, if person have any predominance or dominant symptoms of the diabetes, so we have the stage, pre-diabetic, diabetic. In the pre-diabetic condition, we go only through the diet and lifestyle. No need of giving to medicament, because so many kitchen remedies are we are using as a treatment, like haridra and karvellak, palval. These type of vegetables are very helpful to control for the diabetic person or a glucose level. So in the pre-diabetic condition, as I have mentioned in my slide, there is the whole diet morning to evening night. This diet is a very proven diet. Already we have studied on that before the 7 year, and this is the established diet. We can advise this diet for 15 days, and patient definitely get the result. After the condition, when the diabetes develop or there is the uncontrolled condition, at that time we can implement some herbal medicament of Ayurveda like Avla and Haridra and Nimba and Vijay and Tifla. These all are helpful in this condition. Later on stage, when the diabetic complications are raised, at that time of also Ayurveda medicaments can use with the medicaments, and we can ensure the integrative approach, and we can reduce the complication of the diabetes through the these swarna preparations or metallic preparations like Vasant Kusumakar, etc., Arogya Vardhani, etc., can be helpful to reduce or cure the complications of the diabetes.
Uh, how intermittent fasting is beneficial for the diabetic patients? So, how the
It is
intermittent fasting is
it,
beneficial,
it
and
is very it is
if
a
any
very
person is planning for
yes,
intermittent
sir.
fasting, so what is the your
It,
diet plan? What is to be diet plan, or what is the timing for intermittent fasting? Can you please elaborate?
it is very useful in our classes, because we have classic already treatment modalities given starting from the Langana. The Langana is nothing there. This is the intermittent fasting. Where that at the time of the Langana, we are implicating the one type of intermittent fasting. We only give the patient mudag use, green gram soap at the time of the Langana. At that time of medicaments also we are not giving. So intermittent fasting is very helpful to treat this type of element, or we can involve it as a dietary management, or we can involve as an diet part.
Okay. There is any other questions? So another question is Panchakarma is beneficial for the diabetic management? Dr. Vinay has question.
Definitely management, but before in the pre-diabetic stage, if we perform the whole panchkarma, so there is a very preventive measure for the diabetic patient. We can implement the virechana, or we can implement the other panchkarma therapies in the patient for the prevention and stop the level of the diabetic patients.
I think.
Now all the questions are covered, sir. Now.
Okay, thank you. So I again thanks again. So again, I want to thankful for your valuable section, Dr. Jiten, and I want to also thanks to Dr. Mahesh Vyas sir for their valuable for his valuable time and the beautiful session. I hope our all doctors or our viewers are seeing our webinar, and they have a lot of benefits for regarding their diagnosis, how to treat the diabetes, and how to plan the management of diabetes in their day-to-day life practices. I hope uh, there is one other question is display on the our screen. C peptide done in fasting or meals. So this is the last question I want to ask you.
It is
There,
performed empty
sorry,
stomach, sir. It is
sorry.
performed empty stomach.
Yeah, so he wants to know that. So I hope everybody's queries to be done. So मैं आपका फिर से धन्यवाद करना चाहूँगा डाबर की तरफ से आप कि आपने अपना वैल्यूबल टाइम दिया और एक अच्छे सेशन को हमारे श्रोताओं के सम्मुख रखा. थैंक यू सो मच फॉर योर वैल्यूबल टाइम डॉक्टर जितेंद्र, एंड थैंक यू सो
Thank you,
मच
sir. Thank you.
प्रोफेसर महेश सर फॉर दियर वैल्यूबल फॉर हिज वैल्यूबल टाइम. थैंक यू. थैंक
Thank you, sir. Thank you.
Thank you, sir. Thank you so much, sir.
थैंक यू.
Thank you, sir.